So come on, people. Let's talk about the assessment itself. When we think about assessing a patient, a student, an athlete, we have to make a very careful choice of tests in order to what? To extract the best data from that assessment and for that data to be applied to the sport, to be applied to the activity. There's no point in me selecting a good test, but it won't give me a result that's applicable to that sport. So for this, the first thing, the essential thing that we have to think about when choosing a test is the validity of him. It's not enough just testing without focus. The test has to be good, it has to be valid, it has to give me a result and be an applicable result. This test has to be reliable. I have to have the ability to reproduce this evaluation several times so that the information and results from the test I can analyze together with my team, with my athlete, so that I can measure their progress. Practicality is essential when choosing tests. Why is that? Because the testing can't take too long to administer or be complicated. It can't be difficult. It has to be something practical that gives me the result quickly and directly. And then we get into the characteristics of the tests. How are we going to assess it? What are we going to evaluate? A preseason assessment, a rehabilitation process, or post-season assessment, and various other stages in the sporting life of my athlete, student, client, or patient. There are tests for aerobic resistance, muscle strength, functional movement, balance and coordination, specific tests for each sport, anthropometric measurements that include height, weight, body composition, abdominal circumference, and there are tests for power, speed, agility, balance, and coordination tests. And all these tests have to be selected according to what? According to the modality I'm working with, according to the objective I want to extract from that patient, according to the rehabilitation I'm doing. The stimulus I'm giving my athlete has to be aligned precisely with the choice of test. There's no point in me having a test that doesn't help me, that doesn't give me the right information for my work, for my strength work, or for my rehabilitation work. Therefore, the choice of tests is directly aligned with the specific objective and function of the patient, student, client, or athlete. If I don't align the function, the objective, and my training, there's no point in testing without criteria.